When you own or manage a home healthcare or hospice agency, you have to make sure you keep your policy and procedure manual updated. Agency manuals must be updated to reflect the latest conditions of participation from the Centers for Medicare and Medicaid Services. We've seen many agencies over the past several years not keeping up with COP changes. When surveyors come calling, you need to prove that your agency is complying with the latest regulations. They will review your manual to evaluate whether you are compliant with current ACHC, CHAP, and TJC accreditation standards. If you're launching a new home care agency, instead of starting from scratch with documentation, you can save time by buying a manual in digital format. For established agencies, as a rule of thumb, if you have not updated your policy and procedure manual within the last 3 years, you're already behind schedule, and it's time to consider purchasing a new one. Then, you will need to customize the manual with your company's details and branding, including your name and logo. You cannot just use a downloadable manual without adjusting it to reflect your agency's details. This means that you'll explain the specifics of how your agency complies with a particular policy. It's important to review your updated manual and get the details right before you show them to surveyors. For example, you will need to add a specific job title to indicate who is responsible for carrying out something in the policy, not just the name of the employee. That way, if the person holding a job quits, the agency does not need to change the manual's policy description. To help your agency operate more efficiently, when you order a manual from Kenyon HomeCare Consulting, it will contain an entire HR section that includes job descriptions and their duties for you to customize. The CMS develops conditions of participation that healthcare agencies must adhere to, so they can begin and continue participating in Medicare and Medicaid programs. Medicare and Medicaid's COP standards are designed to improve the quality of services and safeguard the health of patients in the United States. Accordingly, your home care or hospice agency must be prepared to demonstrate you meet all conditions of participation. The professionals at Kenyon HomeCare Consulting provide updated policy and procedure manuals for all service lines, including home health care and hospice agencies, for you to download and customize today. To learn more, call us today at 206-721-5091 or visit the Kenyon HomeCare Consulting website at www.kenyonhcc.com.